Serious Americans who have been treated in hospital for COVID-19, how much did they charge you? What differences are there if you end up in ICU? Also, how do you see your health insurance changing with the effects to your body post-COVID? I was in the hospital 10 days and my bill was $700, which was a lot cheaper than I thought considering the fact I was in the ICU a few days. I already have really good insurance, so it probably won't change. I've only really had some breathing issues since. The CARES Act is supposed to cover medical expenses for the uninsured. NPR had a story on this on October 22, 2020. TriStar, like most major health systems, participates in a program through the Centers for Medicare and Medicaid Services in which uninsured patients with COVID-19 have their bills covered. It was set up through the pandemic relief legislation known as the CARES Act. But TriStar doesn't tell its patients that up front. Neither do other hospitals or national health systems contacted by WPLN News. There's no requirement to, which is one of the program's shortcomings, says Jennifer Tolbert of the Kaiser Family Foundation, who studies uninsured patients. https://www.npr.org/sections/2020/925942412/hospital-bills-for-uninsured-covid-19-patients-are-covered-but-no-1- Tells- Full NPR story link. My insurance covered it all. Pretty early on they said they would cover all COVID-19 cost. I didn't end up in the ICU, so I can't answer that, but it should be covered if it did. Unfortunately I lost that insurance recently due changing jobs, losing it because of the pandemic. Edit. Wow, I didn't think this comment would go anywhere. I have insurance. I found a new job before my old one ended. Thanks for the concerns and tips on insurance. Edit 2. If you live the States and need insurance, do your research. Reach out to a local nonprofit, career center, or your library. These places tend to have an idea where to start looking. Also Google. I know Minnesota has a webpage about COVID. Remember to take care of yourself and be kind to each other. As a low-income resident of Massachusetts, I have Mass Health, which is essentially universal health care. I didn't pay a single dime for my COVID care aside from $3.65 for an inhaler. I didn't get hospitalized, but even in the past when I was, it didn't cost me a single cent. Edit. When I made more money, I still had Mass Health. The highest monthly premium I ever paid was $35 and I was making around $40,000 at the time. Wife had to get one of the free tests, and got a bill. COVID test $0, MD consultation $200. Oh, best part, she only saw a tech who done the swab, never saw the doctor. I went to the ER in March before testing was widely available. I did end up having COVID. I was in the ER for 4 hours, had a COVID test, fluids, flu and strep tests and Tylenol. They billed my insurance $22,000 for that. What the actual *******, and I still had to pay over $800. WTF. Nobody without insurance should be paying for COVID treatment. Here's a link that should help. https://www.hhs.gov/coronavirus/cares-act-provider-relief-fund/for-payments/index.html. No balance billing for the uninsured is permitted. Jesus Christ, I'm so sorry to everyone who has been taken advantage of by unethical, scamming administrators or providers. ETA, please stop gilding me and donate to a local food pantry or literally anything else, thanks. Or just copy the link and spread the information. ETA 2, please don't stop gilding? For visibility? Sorry y'all, Reddit awards are confusing. Thanks for helping spread this info. Good luck everyone, please hang in there. I came down with the virus in mid-March, and when it got so bad I went to the hospital. I was told they could not test for it. They did take my temperature and oxygen level and blood pressure. I was told I had a 102-degree fever, low oxygen count and high blood pressure. They said it was almost for sure COVID and told to go home, take Tylenol and stay in the house. And #X200B, this was at the largest hospital system in the state. So no charge but no help either. I was charged $1,500 for an ER trip. They did not have enough tests, so they did a chest x-ray, had 2 doctors check me out, and sent me home saying they couldn't admit me until I was gasping for air due to the last of resources. I was told to take ibuprofen and drink water. They diagnosed me with COVID. The rest was a blur. COVID was the hardest thing I've physically gone through in my life. I'm late, so this may be buried, but my brother passed due to COVID after a 3-month stay and spent most of his time in ICU. He was uninsured. My mom was sent a $1.4 million bill. My neighbor, on disability and Medicare, was on a respirator for 5 weeks and in that for 5 months. Medicare was supposed to pay for it. They just got a bill for $40,000. 2 elderly people on a fixed income. To make matters worse, her husband got hit by a car and shattered his knee, so he's in a wheelchair. And Medicaid didn't cover all of his expenses either. It makes me so mad. They worked hard for 50 years, paid their debts to society, raised great kids, and now they can't get the help they need. Edit to add. It seems the consensus is that the bill isn't really meant for them. It should be paid off completely or only have a small amount for them to pay, but either billing needs to be changed or they just should not have received the bill. I'll be speaking to their eldest child next week to let him know what's going on, and hopefully they will have one less thing to worry about. Thank you all for informing us. We had no idea, as they've never had hospital bills before. Also, for the jackass who said it's fake, I mean, it's only really hearsay from my elderly neighbors, so, Matt? I think the insurance covered a rather large percentage, but we still have a rather hefty bill. Don't quote me on this because I need to check, but I think our total ran up to $80,000. That's with life support. He went under one night to suction out the gunk in his lungs, something went wrong and they had to intubate him. At the time it was being called unknown pulmonary disease. We lost our jobs, Sue. I had COVID back in March and was briefly hospitalized. The COVID testing was free. Everything else was not. I was charged for supplemental oxygen, not a ventilator, the actual hospital bed, consultations, x-rays, etc. And my lungs really took a pounding, so I've ended up needing to see all sorts of specialists in the wake of it, and get continuous tests and consultations to this day. I work in healthcare and have what is considered very good insurance, and I hit my $2,500 deductible in early June. I've had 3 COVID tests, all covered by insurance. Granted, I'm a healthcare worker, but when I called my insurance, they said everyone is covered. Even the virtual visits to screen me to see if I was eligible for a COVID test were covered 100%. I even canceled a doctor's appointment last minute due to being exposed at work to a positive patient, and they waived the cancellation fee. I'm pretty late to this party. While my insurance covered most of it, the total was around $333,000. I spent about a week intubated in the ICU. About 2 weeks total in hospital. It might have helped that I'm a registered nurse working at this hospital. We had 2 people in my office at work develop symptoms, so we were sent home to work from home. COVID test not required unless we developed symptoms. I scheduled a test at a Hy-Vee pharmacy. Went through the drive-through pharmacy. The pharmacist sent me the testing materials through the tube system. Did the swab myself, dropped the materials in a sealed container, and went about my day. A few days later I was contacted with the results. Cost me $0. I didn't even give them my insurance. It was free.